All right, so we are going to dermaplane a full face today. I have already cleansed the skin and I'm going to now apply oil. I like to do oil planing versus dry planing the skin. It just minimizes less of the irritation to the skin. So I'm just effleuraging a light base oil onto the skin. You really want to make sure you are checking the viscosity of the oils. Sometimes some oils kind of stay tacky and sticky. And what I found in the past, in my experiences, is that sometimes the blades can catch onto the oil and create superficial nicks. And so you really want to make sure that you are using a oil that has a lighter viscosity to it to minimize any of the superficial nicks. So I'm just applying a light base oil. Depending on your time, you can do a full massage prior to dermaplaning if you are doing a custom facial with dermaplaning as an add-on to promote more relaxation, or you can just lightly effleurage the oil to the skin and jump straight into your dermaplaning. So depending on what type of service you are providing to your clients. So I'm just going to remove some of the oil off of my gloves. I'm going to grab my dermaplaning handle, and I'm going to grab my blade. Going to open up the package, keep the blade in the package so you can make sure you're safeguarding yourself so you don't slip and end up cutting yourself. Always make sure that your blade is aligned with your handle, and you're just going to slide that blade, and I'm just going to slide it right in. It's going to click into place. You are going to make sure that you're mentally sectioning out the face. I normally start from the cheeks, working my way up. Always bracing the skin. And always keeping your blade at a 45-degree angle, working towards yourself. I always have a cotton round or a gauze next to me to remove the hair. You want to avoid wiping the skin as much as you can as your blade is doing most of the exfoliation for you. You're going to do about 6 to 9 passes. Again, making sure that your blade is at a 45-degree angle. So I'm going to gently pull down her skin towards the orbital rim so I can get some of those vellus hairs on under the eye. And when you're dermaplaning, you definitely want to avoid any raised moles, open lesions, any active breakouts. You want to probably go around them. You never want to scrape on top of it. That's how you're going to cut or nick the skin. So always, again, making sure you're making sure the skin is nice and taut. And there should be a little bit of erythema as we are exfoliating the skin with our blade. When I get closer to the ear, I always make sure that I'm protecting the earlobe. So I put my thumb by the earlobe, so then if I slip, I don't cut that earlobe or nick it. And whenever you're feeling that you're a little awkward, that means that you have to move your body to a different area of your table. You should never feel like you're awkward and you can't handle and brace the skin. So you might need to adjust your full body and move your chair to a different area of your table. Now as I'm getting towards the chin, I'm going to brace the chin, split the chin in half. And sometimes if my client has more of a dip in their chin, I'll have them tuck their lip in. Can you tuck your lip in for me? Lightly, and so then that gives it more of a flatter surface while you are dermaplaning. When you are on the tip of the chin, you're going to just gently split the chin, go smaller strokes, and kind of go around the curve. Okay, you can relax. I like to feather along the jawline if they do have some peach fuzz there, so there isn't a line of demarcation. So when you notice your blade is doling out, you'll kind of feel a little bit of a resistance from your blade to the skin and hair. So that's when it will indicate for you to change out your blade. So normally a dermaplaning treatment would take about 2 blades, maybe 3, depending on how much hair you're working with. Because the more hair and the more dead skin you have on the surface of the skin, the faster it's going to dole out your blade. So again, I am moved to a different area and I'm still bringing the blade towards me. All right, can you tuck your lip in for me? A little lighter, softer. There you go. Get close to that lip line. I'm going to change out my blade at this point. So I'm using my dermaplaning remover. Place it in, press it down, pull it out. And then putting a new blade in. Okay, so I'm going to do her upper lip. I'm going to again hold her skin taut. Going lightly in small feathering movements. You can see some of the hair and some of the stratum corneum, the dead skin. And as you see, I didn't move to the other side because if I was to move to the other side, my handle would be upward, so then I would get caught on her cheekbones. That's why I'm staying on my right side, moving towards myself, so then my handle is below, so it doesn't get caught along her structure of her face. And now I'm going to go behind her, going to kind of pig nose her a little bit, and I'm going to go up. Okay. So now I'm going to do the same thing on the other side. I'm going to start, have her turn her head, start below and working my way up. Again, keeping my thumb at the earlobe so I don't cut her. Always maintaining contact by holding the skin nice and tight and bracing the skin. I always like to work in between my fingers because those fingers kind of create a guide for me of knowing where I'm hitting my blade. When you're dermaplaning also, you want to make sure you're not dermaplaning over terminal hair. Those hairs may need to either get sugared, waxed, or tweezed. And again, as I'm working on this side, keep on maintaining a 45-degree angle. When your blade is angled flatter, you're not going to get as much of an effective treatment where you're not going to be really getting as much of that hair and dead skin. Look at all that peach fuzz. If you were to do an enzyme peel or a chemical peel after this treatment, you would want to cleanse the skin first prior to your next treatment. But if you're just going into a soothing, hydrating treatment, you can just do a hot towel to remove some of the oil residue and also any excess hair. And then followed with your hydrating, soothing, calming mask. So now I'm going to go back to the right side of my table to work around the orbital rim. Lightly bracing the skin, not dragging that eye area, but just going around that rim to get the hair around the eyes. Now I'm going to work up towards the forehead. Starting where I stopped from the cheek area. Again, continuing to brace the skin tight. The forehead's a little awkward because depending on each person's forehead, they might have a bonier structure, they might have more divots and dips. And so you might need to work in smaller sections and go a little bit slower so you're working around the curvatures and not cutting, not hitting an area that you don't want to and then accidentally nicking them. So I like to go upwards towards myself first. Then I'll move my body and I'll go to the side. One thing that you also want to keep in mind is during this time, have your client be very still because you do have a sharp implement on them. So if they need to sneeze or need to move, have indicators that you guys have already pre-planned and communicated with one another for you to pull the blade away from them. Also, when I'm working around the brows, I also always make sure I'm bracing and covering my fingers on the brows. So if they move or they're talking, you can avoid by taking a piece of their brow off. So getting the Val's hair is definitely gratifying, but the gold is getting that stratum corneum, the dead skin cells. So then you can have better product penetration for them to have smoother, softer skin. Now last but not least, you're gonna go do their nose. You're gonna kind of brace their nose, go using really the tip of your blade. You're not using the full expanse of your blade since the nose is more narrow and tapered. And you're just working on the bridge, very light, small feathering motions, and you can see I'm kind of flattening the nose to give more of a flatter surface to work on. The nose, you have to be very small movements, very methodical. I'm gonna pig nose her, get on that bridge, the tip of her nose. And just lightly going over the curvatures. And at this point with the nose, I do keep my blade a little flatter than 45, just because of how narrow this surface area is. And then I would double check with my magnifying lamp to kind of just look at different angles of the face to do any touch-ups if needed prior to finishing up your dermaplaning treatment. And then now I'm going to follow with a nice warm towel to remove the oil and the residue off of the skin, and then do any finishing products or followed with any facial treatments prior, whether it's an enzyme, chemical, or a treatment mask. And then as we finish up with our service, we are going to finish them with moisturizer. So as I'm finishing my dermaplaning treatment, I'm going to apply a hot towel. Is that temperature okay? I'm going to do some compressions. and then followed with a nice hydrating treatment mask. Forget about that. Take that part off. While we let this mask sit on per manufacturer's instructions, going to remove it.
Is that because you're supposed to use a new towel?
Yeah. And then followed with sunscreen or any choice of finishing products prior to sunscreen. Sunscreen always, as we did just remove a layer of dead skin. The contraindications for this treatment are